Low back pain. The low back, also called the lumbar region, is the area of the back that starts below the ribcage. Almost everyone has low back pain at some point in life. These might range from a dull ache to a stabbing or shooting sensation. Low back pain can result from many different injuries, conditions or diseases, most often, an injury to muscles or tendons in the back. The pain may make it hard to move or stand up straight. Pain that comes on suddenly is acute. It might happen during sports or heavy lifting. Pain that lasts more than 3 months is considered chronic. What are the symptoms of lower back pain? Symptoms of lower back pain can come on suddenly or appear gradually. Sometimes, pain occurs after a specific event, such as bending to pick something up. Other times, you may not know what caused the pain. Pain may be sharp or dull and achy, and it may radiate to your bottom or down the back of your legs, sciatica. If you strain your back during an activity, you may hear a pop when it happened. Pain is often worse in certain positions, like bending over, and gets better when you lie down. Other symptoms of lower back pain include stiffness. It may be tough to move or straighten your back. Getting up from a seated position may take a while, and you might feel like you need to walk or stretch to loosen up. You may notice decreased range of motion. Posture problems. Many people with back pain find it hard to stand up straight. You may stand crooked or bent, with your torso off to the side rather than aligned with your spine. Your lower back may look flat instead of curved. Muscle spasms. After a strain, muscles in the lower back can spasm or contract uncontrollably. Muscle spasms can cause extreme pain and make it difficult or impossible to stand, walk or move. Risk factors for low back pain. Anyone can develop back pain, even children and teens. These factors might put you at greater risk of developing back pain. 1. Age. Back pain is more common as you get older, starting around age 30 or 40. 2. Lack of exercise. Weak, unused muscles in your back and abdomen might lead to back pain. 3. Excess weight. Excess body weight puts extra stress on your back. 4. Diseases. Some types of arthritis and cancer can contribute to back pain. 5. Improper lifting. Using your back instead of your legs can lead to back pain. 6. Psychological conditions. People prone to depression and anxiety appear to have a greater risk of back pain. Smoking. 7. Smokers have increased rates of back pain. This may occur because smoking prompts more coughing, which can lead to herniated discs. Smoking can also decrease blood flow to the spine and increase the risk of osteoporosis. What causes lower back pain? Many injuries, conditions and diseases can cause lower back pain. They include 1. Strains and sprains. Back strains and sprains are the most common cause of back pain. You can injure muscles, tendons or ligaments by lifting something too heavy or not lifting safely. Some people strain their back by sneezing, coughing, twisting or bending over. 2. Fractures. The bones in the spine can break during an accident, like a car crash or a fall. Certain conditions, such as spondylolysis or osteoporosis, increase the risk of fractures. 3. Disc problems. Discs cushion the vertebrae, small spinal bones. Discs can bulge from their position in the spine and press on a nerve. They can also tear, herniated disc. With age, discs can get flatter and offer less protection, degenerative disc disease. 4. Structural problems. A condition called spinal stenosis happens when the spinal column is too narrow for the spinal cord. Something pinching the spinal cord can cause severe sciatic nerve pain and lower back pain. Scoliosis, curvature of the spine, can lead to pain, stiffness and difficulty moving. Arthritis. Osteoarthritis is the most common type of arthritis to cause lower back pain. 5. Ankylosing spondylitis causes lower back pain, inflammation and stiffness in the spine. 6. Sciatica. Muscle strain is often the cause of back pain from heavy lifting or vigorous exercise. But sometimes it's due to small jelly-filled discs meant to protect the space between vertebrae. When one of these discs bulges or breaks, it can push on a nerve. When it's the sciatic nerve, pain runs from the buttock down one leg. This is sciatica. 7. job. If your job involves lifting, pulling, or anything that twists the spine, it may contribute to back pain. However, sitting at a desk all day comes with risks of its own, especially if your chair is uncomfortable or you tend to slouch. 8. Herniated disc. The spine's vertebrae are cushioned by gel-like discs that are prone to wear and tear from aging or injuries. A weakened disc may rupture or bulge, putting pressure on the spinal nerve roots. This is known as a herniated disc and can cause intense pain. Chronic conditions. Several chronic conditions can lead to low back pain. 9. Spinal stenosis is a narrowing of the space around the spinal cord, which can put pressure on the spinal nerves. 10. Fibromyalgia causes widespread muscle aches, including back pain. 11. Disease, spine tumors, infections and several types of cancer can cause back pain. Other conditions. 12. Other conditions can cause back pain, too. These include kidney stones and abdominal aortic aneurysm. 13. Spondylolisthesis. This condition causes the vertebrae in the spine to slip out of place. 14. Spondylolisthesis leads to low back pain and often leg pain as well. Prevention of low back pain. You might avoid back pain or prevent its recurrence by improving your physical condition and learning and practicing proper body mechanics. To keep your back healthy and strong. 1. Exercise. Regular low-impact aerobic activities can increase strength and endurance in your back and allow your muscles to function better. 2. Walking and swimming are good choices. 3. Abdominal and back muscle exercises help condition these muscles so that they work together like a natural corset for your back. 4. Maintain a healthy weight. Being overweight strains back muscles. If you're overweight, trimming down can prevent back pain. 5. Quit smoking. Smoking increases your risk of low back pain. The risk increases with the number of cigarettes smoked per day, so quitting should help reduce this risk. 6. Avoid movements that twist or strain your back. Use your body properly. 7. Stand smart. Don't slouch. Maintain a neutral pelvic position. If you must stand for long periods, place one foot on a low footstool to take some of the load off your lower back. Alternate feet. Good posture can reduce the stress on back muscles. 8. Sit smart. Choose a seat with good lower back support, armrests and a swivel base. Placing a pillow or rolled towel in the small of your back can maintain its normal curve. Keep your knees and hips level. Change your position frequently, at least every half hour. 9. Lift smart. Avoid heavy lifting, if possible, but if you must lift something heavy, let your legs do the work. Keep your back straight, no twisting, and bend only at the knees. Hold the load close to your body. Find a lifting partner if the object is heavy or awkward. How is low back pain diagnosed? Your doctor will likely begin by requesting a complete medical history and conducting a thorough physical examination to determine where you're feeling the pain. A physical exam can also determine if pain is affecting your range of motion. Your doctor may also check your reflexes and your responses to certain sensations. This determines if your low back pain is affecting your nerves. Unless you have concerning or debilitating symptoms or neurologic loss, your doctor will probably monitor your condition for a few weeks before sending you for testing. This is because most low back pain resolves using simple self-care treatments. Certain symptoms require more testing, including lack of bowel control, weakness, fever, weight loss. Additional tests. Likewise, if your low back pain continues after home treatment, your doctor may want to order additional tests. Imaging tests such as X-rays, CT scans, ultrasounds, and MRIs may be necessary so your doctor can check for bone problems, disc problems, problems with the ligaments and tendons in your back. If your doctor suspects a problem with the strength of the bones in your back, they may order a bone scan or bone density test. Electromyography, EMG, or nerve conduction tests can help identify any problems with your nerves. Other types of diagnosis: a chiropractor will diagnose through touch, or palpation, and a visual examination. Chiropractic is known as a direct approach, with a strong focus on adjusting the spinal joints. A chiropractor may also want to see the results of imaging scans and any blood and urine tests. An osteopath also diagnoses through palpation and visual inspection. Osteopathy involves slow and rhythmic stretching, known as mobilization, pressure or indirect techniques, and manipulation of joints and muscles. A physical therapist focuses on diagnosing problems in the joints and soft tissues of the body. Treatment for low back pain. Back pain usually resolves with rest and home remedies, but sometimes medical treatment is necessary. Home treatments for low back pain. Over-the-counter, OTC, pain relief medication, usually non-steroidal anti-inflammatory drugs, NSAID, such as ibuprofen, can relieve discomfort. Applying a hot compress or an ice pack to the painful area may also reduce pain. Resting from strenuous activity can help, but moving around will ease stiffness, reduce pain, and prevent muscles from weakening. Medical treatment for low back pain. If home treatments do not relieve back pain, a doctor may recommend the following medication: physical therapy, or both. Medication: back pain that does not respond well to OTC painkillers may require a prescription NSAID. Codeine or hydrocodone, which are narcotics, may be prescribed for short periods. These require close monitoring by the doctor. In some cases, muscle relaxants may be used. Antidepressants, such as amitriptyline, may be prescribed, but research is ongoing as to their effectiveness, and the evidence is conflicting. Physical therapy, applying heat, ice, ultrasound, and electrical stimulation, as well as some muscle release techniques to the back muscles and soft tissues, may help alleviate pain. As the pain improves, the physical therapist may introduce some flexibility and strength exercises for the back and abdominal muscles. Techniques for improving posture may also help. The patient will be encouraged to practice the techniques regularly, even after the pain has gone, to prevent back pain recurrence. Cortisone injections, if other options are not effective, these may be injected into the epidural space, around the spinal cord. Cortisone is an anti-inflammatory drug. It helps reduce inflammation around the nerve roots. Injections may also be used to numb areas thought to be causing the pain. Botox. Botox, botulism toxin, are thought to reduce pain by paralyzing sprained muscles in spasm. These injections are effective for about 3 to 4 months. Traction, pulleys and weights are used to stretch the back. This may result in a herniated disc moving back into position. It can also relieve pain, but only while traction is applied. Cognitive behavioral therapy, CBT. CBT can help manage chronic back pain by encouraging new ways of thinking. It may include relaxation techniques and ways of maintaining a positive attitude. Studies have found that patients with CBT tend to become more active and do exercise, resulting in a lower risk of back pain recurrence. Complementary therapies may be used alongside conventional therapies or on their own. Shiatsu, also known as finger pressure therapy, is a type of massage where pressure is applied along energy lines in the body. The shiatsu therapist applies pressure with the fingers, thumbs and elbows. Acupuncture originates from China. It consists of inserting fine needles in specific points in the body. Acupuncture can help the body release its natural painkillers, endorphins, as well as stimulating nerve and muscle tissue. Yoga involves specific poses, movements, and breathing exercises. Some may help strengthen the back muscles and improve posture. Transcutaneous electrical nerve stimulation, TENS, is a popular therapy for patients with chronic back pain. The TENS machine delivers small electric pulses into the body through electrodes that are placed on the skin. Experts believe TENS encourages the body to produce endorphins and may block pain signals returning to the brain. Studies on TENS have provided mixed results. A TENS machine should be used under the direction of a doctor or health professional. It should not be used by someone who is pregnant, has a history of epilepsy, has a pacemaker, has a history of heart disease. TENS is considered safe, non-invasive, inexpensive, and patient-friendly, and it appears to reduce pain, but more evidence is needed to confirm its effectiveness in improving activity levels. Surgery for back pain is very rare. If a patient has a herniated disc, surgery may be an option, especially if there is persistent pain and nerve compression which can lead to muscle weakness. Examples of surgical procedures include fusion, two vertebrae are joined together, with a bone graft inserted between them. The vertebrae are splinted together with metal plates, screws or cages. There is a significantly greater risk for arthritis to subsequently develop in the adjoining vertebrae. Artificial disc. An artificial disc is inserted, it replaces the cushion between two vertebrae. Discectomy. A portion of a disc may be removed if it is irritating or pressing against a nerve. Partially removing a vertebra. A small section of a vertebra may be removed if it is pinching the spinal cord or nerves. Injecting cells to regenerate spine discs. Scientists from Duke University, North Carolina, developed new biomaterials. They can deliver a booster shot of reparative cells to the nucleus pulposus, effectively eliminating pain caused by degenerative disc disease.